Gentlemen, let's get straight to the question most men over 30 are secretly worried about, but almost never say out loud. Can my manhood actually shrink as I age? The answer, backed by both science and years of clinical observation, is yes. Changes in size and function can happen. But here's the good news. It's not inevitable. Most of the causes are not mysterious, uncontrollable forces of aging. Instead, they're deeply connected to lifestyle, circulation, and everyday health choices. That means you hold the power to influence the outcome. This video isn't about gimmicks, miracle pills, or strange devices. It's about real medical knowledge combined with practical strategies you can start using immediately. My goal today is simple: help you understand why these changes occur and show you how to stop or even reverse them before it's too late. So let's begin with the first and most natural factor, aging itself. 1. The aging process in circulation. As a physician, I often explain aging to my patients using the highway analogy. When you're young, your arteries are like brand new highways, smooth, wide open, and traffic flows freely. Blood can reach every part of your body, including the most delicate areas, without delay. But as we get older, small deposits of fat and cholesterol begin to build up along the artery walls. This process, called atherosclerosis, is like traffic jams forming on those highways. The smaller the arteries, the more vulnerable they are, and the blood vessels supplying the penis are some of the smallest in the entire body. What does that mean in real terms? Over years, less blood flows into the erectile tissues, the corpora cavernosa. These tissues are like sponges. They must be completely filled to expand fully. If blood can't reach them effectively, the spongy tissue gradually loses elasticity. The result? Erections that are less firm, less full, and over time, a measurable reduction in visible size. This process doesn't just affect intimacy, it's also a warning signal for your overall vascular health. In fact, difficulty maintaining erections can sometimes be one of the earliest signs of cardiovascular disease. That's why addressing it is not only about confidence, it's about survival. 2. Weight gain and the buried penis effect. One of the most common reasons men believe they're shrinking is actually a visual illusion caused by excess body fat. When men accumulate weight, particularly around the abdomen and pubic area, a thick pad of fat develops at the base of the penis. This pad essentially swallows up the first inch or two of the shaft, hiding it beneath the tissue. Now, let me be clear. The physical length of the organ hasn't changed, but the visible length has. For many men, this can be just as distressing. Clinical studies suggest that for every 30 to 50 pounds of excess weight, a man can appear to lose up to an inch of length. That's no small number, and it can seriously affect self-image and confidence. When men commit to weight loss through diet, strength training, and cardio, the improvement is dramatic. Not only does the buried portion reappear, but circulation improves, energy rises, and hormones rebalance. The benefits extend far beyond appearance. 3. Smoking and excessive alcohol. Smoking is the enemy of your arteries. Every puff damages the delicate lining of your blood vessels, accelerating atherosclerosis and making them stiff and narrow. What does that mean for men? Reduced circulation where it matters most. Many long-term smokers experience weaker, less consistent performance, and once damage is advanced, recovery can be difficult. Alcohol, when abused, is just as destructive. While moderate use might not cause major harm, heavy drinking interferes with testosterone levels, disrupts brain signaling, and dulls the nervous system. I've seen countless men who believed alcohol was helping them relax in the bedroom, but in reality, it was quietly undermining their long-term vitality. So if you smoke, quitting is one of the most powerful health decisions you'll ever make. And if alcohol has become more than an occasional indulgence, reducing intake can quickly improve both mental and physical energy. At this point, you can already see the pattern. Whether it's aging, weight, or lifestyle habits, the root cause is almost always circulation and tissue health, and that means the solution is within reach. 4. The forgotten rule of men's health. One principle I emphasize to my patients again and again is simple but often overlooked. Your body only maintains what it uses regularly. This applies to muscles, joints, lungs, and yes, even your intimate tissues. When erections occur, whether during intimacy, self-stimulation, or naturally at night, something vital happens. The erectile tissue is stretched and flooded with oxygen-rich blood. This process works like a workout for the tissue, keeping it elastic, resilient, and healthy. But here's the problem. If those erections become infrequent, the tissues don't get their workout. Without stretching and oxygenation, they gradually lose elasticity. Over years, this can translate into a visible reduction in size and rigidity. Men should stop thinking of regular sexual activity as a luxury. It's actually a form of preventative medicine. Just as we tell patients to walk daily to maintain heart health, regular intimacy, in whatever form, plays a role in maintaining intimate function.
5. Medical conditions that directly impact size. While lifestyle is the primary driver, certain medical conditions can have a direct and sometimes sudden effect. Let's look at the two most significant. Peyronie's disease. This is a condition where scar tissue develops inside the shaft, causing a bend or curvature during erections. Because scar tissue is rigid and cannot stretch, it can shorten the functional length. It's not extremely common, but when it happens, the psychological impact can be severe. Treatments exist, from medication to surgery, but early diagnosis is critical. Prostate cancer surgery. This is a life-saving procedure, but it sometimes comes with an unexpected side effect, shortening of the penis. The surgery can affect nerves and connective structures around the base. While the amount is usually small, it can feel significant to patients. If you face a medical condition like these, don't suffer in silence. Men often delay seeking help due to embarrassment, but modern medicine has more solutions today than ever before. 6. The role of hormones and mental health. Another factor that doesn't get enough attention is hormonal balance, specifically testosterone. Low testosterone isn't just about fatigue or decreased libido. It's also linked to weaker tissue quality and reduced function. And then there's the mind-body connection. Chronic stress, depression, and anxiety can physically constrict blood vessels through constant cortisol release. Men who live under constant stress often complain of decreased performance and sometimes even visible changes over time. Here's the nuance. Mental health is just as important as diet and exercise. My opinion, from treating hundreds of men, is that stress management isn't optional. It's mandatory if you want to preserve your vitality long term. Now that we've covered the causes, let's transition into what most of you are waiting for: the strategies you can start using immediately to protect yourself and maintain size, strength, and confidence well into your later years. 7. Strategy 1. Maintain a healthy weight. If I could give men over 30 only one piece of advice, it would be this: don't let extra pounds accumulate silently. Carrying 30 to 50 pounds of excess weight doesn't just put stress on your heart and joints, it creates that pubic fat pad that visually shortens the penis. I've seen patients regain over an inch of visible length just by losing belly fat. Fat diets won't sustain you. Instead, aim for a balanced long-term plan. High in protein to preserve lean muscle, rich in vegetables and fruits, antioxidants protect blood vessels, moderate complex carbs for energy, avoiding ultra-processed foods that sabotage metabolism. Pair this with regular exercise, not just for fat loss, but for circulation and hormone balance. 8. Strategy 2. Prioritize cardiovascular fitness. Think of your circulatory system as a network of highways. If you want maximum vitality, those roads must stay clear and flexible. Cardio exercise, brisk walking, cycling, swimming, jogging, is a direct investment in both your heart and your manhood. Studies consistently show that men with strong cardiovascular health report better performance, stronger function, and fewer issues with shrinkage. Men should stop seeing cardio as just for weight loss. Instead, see it as the primary training for intimacy health. A strong heart equals strong performance. Period. 9. Quit smoking immediately. I'll be blunt here, no sugarcoating. Smoking kills your blood vessels. It narrows them, stiffens them, and destroys their ability to deliver blood where it's needed most. The good news? The body has an amazing ability to heal once you quit. Within weeks, circulation improves. Within months, many men notice firmer, fuller performance. I've seen men who thought their best years were behind them completely transform after quitting. This is one of the most powerful steps you can take, not just for your intimate life, but for your longevity. 10. Strategy 4. Optimize your diet for blood flow. What's good for your heart is good for your manhood. Let's break it down. Eat more leafy greens, berries, nuts, salmon, olive oil, avocados. Limit refined sugar, processed carbs, fried foods, and excess red meat. Foods high in antioxidants reduce inflammation, protect blood vessels, and keep arteries clear. Omega-3 fatty acids, like in salmon or walnuts, make vessels more flexible. My opinion, you don't need to eat perfectly. Follow the 80-20 rule. Eat clean 80% of the time, enjoy yourself 20%. Consistency matters more than perfection.
11. Strategy 5. Keep the engine running. Use it or lose it. We already discussed the physiology. Erections are exercise for your intimate tissues, so make sure the engine keeps running regularly. This doesn't mean obsessing over frequency. It simply means keeping things active, whether through intimacy with a partner or solo activity. Consider this as physical therapy for your intimacy. If you stop using a muscle, it atrophies. If you stop maintaining tissue, it stiffens. The same principle applies here. 12. Strategy 6. Manage chronic conditions proactively. High blood pressure, high cholesterol, diabetes. These are silent destroyers. Left uncontrolled, they attack your arteries, especially the smaller ones. I've seen far too many men ignore these conditions only to show up years later with serious complications both medically and intimately. Don't wait. Work with your doctor. Get blood work done yearly. Take prescribed medications seriously. You wouldn't ignore the oil light in your car. Don't ignore your body's warning signals either. Preventative care is cheaper and far less painful than crisis care. 13. Master stress management. Stress is more than a mental weight. It's a physiological poison when it becomes chronic. Constant cortisol release narrows blood vessels, lowers testosterone, and disrupts intimacy signals from the brain. The fix? Find your stress outlet. Meditation, deep breathing, lifting weights, spending time in nature, even hobbies, they all work. In my professional experience, men who manage stress consistently often report improvements not just in energy and mood, but in size and function as well. Relaxation literally improves circulation. At this point, you can see the full picture. Shrinkage isn't a random curse of aging. It's a reflection of circulation, tissue health, and lifestyle choices. And the best part? Every single one of these strategies not only protects your confidence, but also shield you from heart disease, diabetes, and early decline. Conclusion. Gentlemen, let's step back and look at the big picture. Yes, your manhood can shrink over time, but no, it is not an unstoppable fate. The truth is, most of the causes are lifestyle-driven and completely within your control. It's not about miracle pills or secret devices. It's about keeping your arteries clear and blood flow strong, managing weight so you reveal your full size, quitting destructive habits like smoking, eating and exercising in a way that supports your circulation, staying sexually active to keep the tissues flexible, managing medical conditions before they manage you, and protecting your mental health so stress doesn't silently sabotage your body. The very strategies that prevent shrinkage are the same ones that keep you alive longer, sharper, and more confident. You're not just protecting inches, you're protecting your entire future. So the real question is, are you willing to take responsibility today, or will you wait until problems force you to act? If this video spoke to you, don't keep it to yourself. There are millions of men over 30 silently worrying about this very issue, but too embarrassed to ask. You can help them by sharing this knowledge. Hit that subscribe button, join the Men's Health Secrets community where we break down the science, the myths, and the practical strategies every man needs. Like this video if you found even one piece of information valuable. And most importantly, share this with a brother, a friend, or anyone who needs to hear the truth about protecting their vitality. Gentlemen, don't wait until decline is obvious. Don't let stress, poor circulation, or lifestyle habits steal what's rightfully yours. Start today. Take control, reclaim your confidence, and protect your manhood for decades to come. This is Men's Health Secrets, and I'll see you in the next video.